number one thing we're focused on is really supporting nurses. Nurses have been through perhaps one of the most difficult couple years in the history of the profession. And so as a state association, a lot of what we do that through policy. So right now we're trying to listen to nurses in terms of what their needs are and try to figure out what we can best do. We've done a lot of work in trying to create work environments for nurses or support work environments that promote positive nursing practice, so that give nurses voice in their workplaces. So some of those are like staffing. Staffing is the number one concern about nurses, and especially during COVID, 80 to 90% of nurses were unhappy with the staffing. We're very concerned about it being safe. We do have a safe staffing law in Texas, but we think there are opportunities to improve that law, make it stronger. The second thing is workplace violence. It's kind of a dirty little secret, but nurses often bear the brunt of violence. And during COVID, it got much worse as people were frustrated. They didn't like wearing protective equipment. Sometimes visitation was limited. There are things that can be done to prevent workplace violence, and one of those is for hospitals to be required to establish workplace violence prevention plans, and for nurses to have input into those plans. We're hoping that bill will finally be successful this session to make sure that nurses have safe environments to practice in. And then another area is well-being. We hear a lot about nurses' resilience, that nurses need to take care of themselves and they need to do this or that. But nurses' work environments need to support nurses being able to take care of themselves. So they need breaks, they need to have days off, they need to have reasonable workloads, they need to be protected from workplace violence. That will help prevent the mental health challenges that many nurses are experiencing. We are very actively working with legislators and talking, the governor set aside funds specifically to address the nursing shortage, and we're working with the governor's office and how those funds can be utilized to increase the availability of clinical spaces and find creative ways to open up that bottleneck, which helps schools produce more nurses.